Hi, I'm Dr. Jyoti Patel, and today we're talking about allergies. This time of year, I get a lot of questions from my patients about why I have allergies, what I can do about it, and if I recommend any testing. So if you're interested in allergies, stay tuned. Hi, I'm Dr. Jyoti Patel. I'm a wife, mom, and physician, and it's my mission to empower you with knowledge so that you can take back control of your health. If this serves you, subscribe to my channel, hit the notification bell so that you're updated whenever I have a new video. So let's get started. Allergies. Why are there rising rates of allergies and asthma in the Western world compared to developing countries? Well, the answer lies in the changes of our internal and external environment. So what does that mean? Our internal environment is our gut microbiome. It's the good bacteria in our gastrointestinal tract. This bacteria helps our immune system decide if something is friend or foe, good or bad. Unfortunately, with all the changes that we've made, we're actually decreasing the population of good bacteria in our colon and reducing the diversity of this bacteria. And so now our immune system isn't able to tell the difference between good and bad, and it reacts to everything, whether you inhale it, whether you ingest it, whether you inject it, whether you put it on your skin. You're more likely to be sensitive to more and more things because this good bacteria is missing. We also have changed our external environment. The bacteria that lives in the soil, on the plants, the pollution that's in the air, in the water, in the soil, the chemicals in our food, all of these things have changed in the Western world as we have industrialized. And this has increased the risk of allergies and asthma. So how do you test for it? Well, I'm an old school doc, so a lot of times I just ask my patients to journal their symptoms, write down what they're sensitive to or what they think they're sensitive to, what their symptoms are, and be able to figure out what we need to avoid. Again, I might sometimes put my patients on an elimination diet, taking away more of the common things that people are sensitive to, and then reintroduce them to see how my patient reacts. But if you're looking for more objective testing, you can get skin testing done, you can get blood testing done to see if you are allergic to certain things in your environment or food. So what can you do about it? Well, my first approach always is lifestyle. First is your environment. So first you can remove things from your environment that you might find you're sensitive to, whether it's dust mites, whether it's pet dander, whether it's pollens that come in through the home, through the windows. You can have mattress covers, HEPA filters. You can keep your environment cool. You can clean and wash your sheets, vacuum your carpets. Reduce exposure from your pet dander by not having them come to bed with you. These are some things that you can do for environmental controls. Nutrition is also another big factor. I make sure that my patients are optimizing their vitamin D. I might suggest taking vitamin C. I also recommend omega-3 fats like fish oil. So eating a healthfully diet, fruits and vegetables, antioxidants, lots of things from the earth, obviously organic and clean products, meats that are clean, obviously not the ones that come from factories that are injected with hormones and chemicals and antibiotics, but fresh organic produce, fresh organic meats, wild caught and wild game. These are the kinds of foods that you should eat. Okay. I also recommend mind-body techniques. There's a lot of studies that actually show that when you're agitated and your cortisol levels are elevated, or you haven't slept and your stress levels are higher, you also have a histamine response that's more triggered. And this histamine response can make you sensitive to foods that you normally could eat. So you might have what's called histamine intolerance, and this actually has to do more with the stress response than anything else. So mind-body techniques, breath work, stress reduction, exercise, sleep routines, meditation, all of these things are also really important when controlling asthma and allergy symptoms. Most people don't think about that. So in addition to the lifestyle changes and the environmental controls, there are some over-the-counter medications. It's a billion-dollar industry. A lot of people take antihistamines or leukotriene inhibitors or nasal steroids or mast cell stabilizers or using saline sprays. And these are all fine tools to help you control some of your symptoms. If you see an allergist, you might get allergy shots, which are basically immunotherapy, giving you the pollens, giving you the allergens to make your body more sensitized to them. You can either do this through an injection or orally or through a patch. So that's sublingual immunotherapy or epicutaneous patches where you can get the pollens delivered to your system, getting your body used to those pollens. There's also other things like Xolair, which is an injection immunotherapy. So there are so many things on the conventional side, but there are a few things on the natural side too. I also recommend sometimes nettles, butterbur, quercetin. So there's some homeopathic remedies as well that can help with allergies and asthma. But like with everything else, before taking any supplement, I recommend that you talk to your physician and make sure that it's right for you. As you know, this is simply for education purposes only, and my intention is not to treat, but to give you information so that you can take control of your health. So that's it for allergies. Remember that you have to work on the whole paradigm, work on your gut microbiome, work on your nutrition, work on your stress habits, environmental controls, and if you have severe asthma or allergies, seek consultation with your doctor. You might need an EpiPen if you have anaphylactic reactions to things. You might need prescription medications to control your allergies. So that's it for allergies. Thanks for watching. I'm Dr. Jyoti Patel. Follow me on Facebook, Instagram, and Twitter. Till next time.